Established in 1983, AMSA Malaysia has nurtured future doctors to disseminate knowledge, undertake creative vocations, conduct community services, and foster new friendships. Now, AMSA Malaysia has blossomed into a member-based, non-profitable, non-sectarian, and non-political organization. With friends and members present countrywide, AMSA Malaysia has new offshoot spelling, which are public relations and alumni, academics and research, multimedia and publicity, public health, and the Asian Medical Students Exchange Program, AMSEP. The fundamentals rooting AMSA Malaysia for its sustenance to this day are knowledge, action, and friendship. Follow us on our social media at Facebook and Instagram. Stay tuned to AMSA Malaysia. Viva AMSA, building bridges, sharing dreams.
A very good morning to our prestigious guest today, Dr. Amelia Afsan Muhammad Jamil, board members of AMSA UPM, and to all the attendees for the event today. I am Shri, the MC of this first talk. Today, we are having an amazing event centered around a great individual to many of us, not only us humans, but also for animals. The only being that carries us before being born, as it is her own. It is none other than a mother. The mother's love is one of the most noble ones the offspring can ever get. Well, before we dive into this event, I represent AMSA UPM to wish all the mothers out there who thrive for their children's survival a happy Mother's Day from deep in our hearts. It is my utmost pleasure to welcome all of you to the Assist Mom and Child Community Service AMCCS 2021 organized by the Asian Medical Students Association AMSA of UPM. Now, before delving into our guest of honor today, there will be 4 events going on today, consisting of 3 talks and an exciting quiz session. It starts with Too Young to Be a Mom, which is going to start now, followed by Safe Motherhood Talk, and before ending with a quiz, there will be one last talk about child CPR and first aid. Don't worry guys, of course there will be intervals in between. Well, we shouldn't forget our reputable guest of honor today. As I mentioned before, Dr. Amelia Hafsan Muhammad Jamil. A bit of her history. Dr. Amelia completed her degree in Bachelor of Medicine and Surgery at the International Islamic University Malaysia and obtained her Masters in Obstetrics and Gynecology at University of Science Malaysia. She then accomplished her fellowships in Maternal Fetal Medicine in University Kebangsaan Malaysia Medical Centre and the Singapore General Hospital respectively. Currently, it is really proud to say that Dr. Amelia is a senior medical lecturer and a specialist in obstetrics and gynecology in University Putra, Malaysia. Now, what are we waiting for? I think giving the stage to Dr. Amelia will be the right thing to do. Welcome, Dr. Amelia.
Hi, Shri. Can you hear me?
Yes, Doctor. Hi, we can hear you.
Okay. All right. Right. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. So I shall share my slides first before we go on. All right. All right. Okay. Shri, thank you so much for the kind introduction. Before I start, okay, I would like to congratulate the AMSA Society for organizing this talk, which I think perhaps in conjunction with Mother's Day. So, Shri, thank you for the Mother's Day wishes. I'm a mother I'm a mother too. So today also is my daughter's birthday, right? So for the participants, thank you for joining this significant session. For me, it's very important. Your friends are doing something for the betterment of the mothers and the child in Malaysia, right? So kudos to AMSA. Then I know a lot of you are actually busy today. This is the last weekend before Raya. Some of you preparing for Raya, right? Some of you are counting days, perhaps to estimate how many people can come and visit you, depending on which piece your house in, right? So, but today we're going to talk about another P, which is pregnancy, all right? So pregnancy and childbirth are supposed to be a happy occasion for the parents, for the mother. Okay, baby supposed to be welcomed, but for our session today, it might not be, right? Since perhaps some of the mothers might become pregnant at a very young age. Okay. Right. So first of all, let us define young. Right. How you define young? All right. All right. So this is Lina. This is Lina Mahina. All right. So Lina Mahina, she was a young children at the age of 5 years old who live in a remote village in Peru. Okay. So she was like other girls until one day the parents noticed her tummy becomes gradually distended. So they brought Lina to see a doctor, right? So initially the doctor thought Lina was having ovarian tumor, but to their surprise, Lina was actually pregnant at the age of 5 years old. So Lina was the youngest confirmed mother in the history. So she gave birth at the age of 5 years old by cesarean section. Okay, so Lina has a special condition called precocious puberty, right? From the medical report, the doctors reported that she attained menarche at the age of 3 years old. Some say at the age of 8 months old. So we are not sure when, but definitely when the doctor assessed her, she had a fully developed secondary sexual characteristic. Right, but the problem is the impact on Lina itself, right? So Lina was delivered by cesarean, the baby was delivered by cesarean section. So Lina, as a child, she loved to play with dolls rather than to play with her own son. And we are not sure what happened to her that leads to her pregnancy. So until now, she can't even mention who actually the father of the child. And until now, she kept quiet, right? So this is the story of a child pregnancy at the age of 5 years old. So this is Lina Mahina. Okay. Right, some of you might think that 25 years old is young, right? Especially you all medical students, right? When you graduated, maybe you are 24 years old, and then you wait for another 1 year for housemanship, and then you want to complete your housemanship another 2 years. You want to gain something before you embark into marriage, into pregnancy. So you think 25 is young, right? Some might think 35 is still young, right? So you want to wait. There are things that you want to achieve before being a mother, right? So right, we are not going to talk about pregnancy as early as Lina or young in your own definition, right? So we are going to talk about teenage pregnancy. Okay, so the definition of teenage pregnancy is, by WHO, is a pregnancy that occurs in young females aged 10 to 19 years old. Right. So it's difficult to discuss on this topic without some emotional elements. So teenage pregnancy is not in the syllabus, right? So for those of you who are already in ONG, so you know that we don't have a specific topic on teenage pregnancy, but it actually imposes a significant effect or significant impact in our country and to the maternal and child health, right? It's kind of emotional because I am a mother of a teenage girl as well. So you know that today is my daughter's birthday. She's 15 years old today. So it is so sad to imagine out there might be a girl at her age pregnant and don't know what to do, right? Because teenage pregnancy involves a lot of issues. It involves issues of poverty, it involves issues of unplanned pregnancy, and the pregnancy has a significant impact to the teenagers and their babies. Okay. Right. So if you look into the statistic, right, worldwide statistics, right, it is found that 13 million children are born to mother under the age of 20 worldwide, right? So if you look into the graph, right, the highest rate of teenage pregnancy is in sub-Saharan Africa, and you talk about United States and United Kingdoms have the highest teenage pregnancy rate in developed country. Okay, teenage pregnancy is a global issue, right? So what about in Malaysia? Right, in Malaysia, there are around 14 in every 1,000 underage girl get pregnant every day, right? That would be around 18,000 girls in a year. So our statistic is a bit high compared to Singapore, who has the rate of 4 pregnancy in 1,000 underage girls, as well as in Hong Kong, where they only have 3 out of 1,000. Okay, if you look into the states, Sabah and Sarawak has the highest prevalence. Of course, if you talk about unwanted pregnancy, with this MCO, there is a rise of unwanted pregnancy because of the lack of access of contraception. So why our prevalence are slightly higher or are higher compared to Singapore or Hong Kong? Because in Malaysia, we have more child marriage, and in certain states like in Sabah and Sarawak, it is, and in Orang Asli community, it is actually socially acceptable. All right, so we look into the age of first marriage, right? Okay, if you look into the slides, all right, the legal age of consent in Malaysia is 18 years old, but the legal age of consent for sex is 16 years old, right? So by law, if a boy want to marry before the age of 18, or a girl who want to marry before the age of 16, in a non-Muslim, they have to get a permission or a grant from a chief minister, and for Muslim, it must be approved by Sharia law, and there must be signs of puberty. But if you look into the statistic, right, a Malaysian Population and Family Survey, this is in 2004, 22% of girls before the age of 19 years old were married, and the double of the number is in Sabah. Okay. All right, so this is in general the statistics or global estimates in Malaysia. If you see, there is 1,500 children married every year as of 2018. Right, so a child marriage, it happens both in urban and in rural area, and it actually occurs across the states of Malaysia. If you look into this, so I got this from UNICEF, Sabah has the highest number of marriage, while in Pahang has the highest in Peninsular Malaysia. Okay. Right. So what are the global impact of teenage marriage? Right. Marriage girls are more vulnerable for domestic violence. Right, many married children suffered disrupted emotional and psychological development, and married children are less likely to remain at school, leading to high risk of sustained poverty. Okay, right. So we look into the statistics. Right, so if you look into the statistics, so this is in the Google. If you Google it, this statistic is in one of the newspaper, right? This is the statistic of teenage pregnancy from 2014 to 2018. So if you look at the trends, the trend of married teenage pregnancy is reducing, right? But the one that makes us worried are the trends of the unmarried teenage pregnancy. If you look at the trend, it is sort of statics. So there is no much changes in the rate of the unmarried teenage pregnancy throughout the year, right? All right, so these are another statistics, right? So basically, right, there is an increasing, basically a static trend, so perhaps an increasing trend of a baby who delivered by unmarried mother, and because of that, there is a higher risk of baby dumping. There is a higher prevalence of baby dumping. Okay, right. So this is another statistics of unmarried teenage pregnancy. So if you look at this, Sabah has and Sarawak has the highest statistic, followed by Selangor, Johor, and Pahang. Right. So this is the biological basis of teenage pregnancy. So when does a girl can conceive? Right. A girl can conceive from sexual intercourse as early as when she started to ovulate. So ovulation usually takes place after the first menstrual bleeding, which is menarche. So the mean age of menarche in Malaysia is around 12.8 years. So it ranges around 11 to 13 years old. Right. So maternal and one of the key indicators that determine the development of the countries, so whether the countries are developed or not, are the health of the woman and child. So this is how important it is, a woman and children to all countries in the world. So that's why the event today is very significant. Okay. So these are the goal that is targeted by WHO in 2015, right? So there are goals specifically targeted on maternal mortality and under 5 mortality. So the plan is to reduce the maternal mortality rate to 3/4 and to reduce the mortality of under 5 under 2/3, right? So this goal was not met, right? Because of the adolescent pregnancy, one of the reasons, because adolescent pregnancy leads to increased infant and maternal mortality. And there is one more goal, to eliminate gender disparity in all level of education. So because in many parts of the world, pregnant girls are not allowed to remain in school, so this goal also was not met. So WHO come up with another goal we call Sustainable Development Goal. So by 2030, there should be a reduction in global maternal mortality ratio to less than 70 per 100,000 live birth. So there must be also a universal access to sexual and reproductive health. So one of their target are adolescent, right? Because adolescent pregnancy impose a great risk to the mothers and also to the child they actually carry. Okay, so these are the risk factors of teenage pregnancy. So in general, if you talk about teenage pregnancy, they are a bit different in developed countries and developing countries. All right, developed countries are often associated with social issues. Those who actually pregnant do usually have lower education level. They are usually live in poverty, and they have a better social and healthcare support. But in developing country, generally it is culturally accepted. Usually this mom will end up with malnutrition, and also they have a poor healthcare. So what about Malaysia? Right, Malaysia is in the middle. All right, so in some states it is culturally acceptable, right? But in certain area it is associated with social issues. We generally have a better social care and healthcare, right? But usually our teenage mothers have lower education level, and also they live in poverty, right? Right. So this is a story of Anna. Okay. So Anna is become pregnant at the age of 15 years old, right? She's a school dropout. She live in a broken family with problematic siblings, right? So she live under poverty, which forced her mother into prostitutions. So Anna then get involved in high risk behavior. Okay, so she's involved in drug. Then one day, unfortunately, she was gang raped by the brother's friends. So she lodged a police report. So her case was in local newspaper, and then she was confirmed pregnant. Okay, so she left her baby in the hospital, and the baby was then adopted by the doctor. So this is one of the sad story of teenage pregnancy in Malaysia, right? If you look into the statistic, the papers, okay, a lot of them, especially the unwed one, unplanned one, the story are almost like this. Okay, right. So these are all the risk factors of teenage pregnancy in Malaysia. We look into the profile. They usually come from low-income family. They have lack of parental supervisions, poor academic achievement, lack of sexual and reproductive health information. They are into the pornographic material, engage with unhealthy behavior, peer influence, premarital sex, and lack of religious knowledge and practice. All right. So if you look into the profile, right, of risky sexual behaviors among teenagers, comparing boys and girls, teenage boys have higher percentage to embark on early sexual activities compared to girls, because they actually have early sexual debut, and they like to share their pornographic materials among themselves, and most of them live in rural area. All right. Okay. Poverty is highly associated with teenage pregnancy in Malaysia. And the sad thing is, when they become pregnant, they tend to drop out from school, they continue with the way they live, and then they embark into poverty once they become adult because of the poor education. So it affects their children as well. So the children also tend to have a low IQ, they have low education level, they tend to drop out from schools, and the cycle of the poverty continues. Right. These girls, they have a huge gap with their parents, right? They have lack of communication. Some of them are having problematic parents who are always quarreling or is busy with work because of the poverty. So they have lack of supervision, right? So lack of supervision, lack of love, excessive freedom make them wandering around looking for friends outside their home. All right, so they are actually have lower educational level compared to the non-pregnant counterpart. Okay, so majority of them only schooling up to secondary schools. Around half of them, or 22% of them, only until primary education, and around 3% of them don't have any formal education at all. So this teenage pregnancy, these teenagers who are not involved with school activities have a significantly higher chance of becoming pregnant. Right. They also have a lack of sexual and reproductive health information. Why? Because this topic is widely considered as taboo in Asia, right? So we are embarrassed to talk about this topic. The parents tend to avoid talking about birds and bees. The school teachers whiz through the boys and girl anatomy sections. So the youngsters discuss about this in harsh whispers because they consider this as a taboo. So which leads to these youngsters ill-equipped with sexual and reproductive health knowledge. Leads them to make a rash and bad decision. So if you look at the source, okay, majority of girls in Klang Valley said the source of the sexual, reproductive and health information were from their mothers. However, in Kelantan, 65% of them say it's from their friends. So the overall score of their knowledge is only 4 of 10, failed, right? And 30% of them don't even know they can become pregnant after a single act of sexual intercourse, right? So around 12% don't know they can actually get sexually transmitted disease from sexual intercourse. And around 70% of them think that washing the vagina after sexual intercourse prevents pregnancy. Okay, what about knowledge of contraception? All right, so we look into the knowledge of contraception among public university students. All right, the mean knowledge score of participants in public university is only 4, failed, and the score awareness score is only 20, right? So we look into UPM medical students' knowledge on contraception. So this is published by one of your former lecturers. So it seems that your knowledge as medical students as well as the awareness also are very low. And there are some degree of misperceptions on contraceptions as well. So this one is the knowledge among university students and medical students who actually have like higher than average education level, right? What about what more the adolescents? All right, so we look into the adolescent knowledge, right? So most of them know, right, that about contraceptions, okay? While condom and pills are most popular among them, right? A few of them know about abstinence. What about the implementation, right? You see, 4.8% of them had done a sexual intercourse before, but the rate of them using contraceptions are only 35%, while 15%, only 15% use contraception when they did a sexual intercourse at the age of 13 to 17 years old. All right, so this is scary, right? So this is one of the quote that I get from a paper from the teenage girls who get pregnant. So I know about contraception, but I never use it. I never use condom, and I feel that even when I use it, I can still get pregnant. So why bother? This is how they feel. This is how awareness, how they are not aware of the contraceptions. Okay. All right. So pornographic materials, right? So national survey in 1998 shows that 50% of adolescents aged 14 to 15 years old have read pornography, and 44% of them had seen it in magazines or videos. This is in 1998, before the era of smartphone and YouTubes. So what happened after the era of smartphones and YouTubes? 70% of them are exposed to pornography on the internet, right? And then this is a study that reported that teenagers who watch pornography tends to engage with free sex and change partners. And 53% of these teenagers who are addicted to pornography ends up having sex outside marriage with their partners, right? So this is the catastrophic consequences of unlimited internet access to our teenagers, right? Right. A lot of them are engaged with high-risk activities as well. They tend to spend time doing smoking, drinking alcohol, using illicit drugs, clubbing, and motorcycle racing. So this is the quote that I get from studies. This study was done in a safe home where they placed the teenage pregnant mothers. Okay, so they know they actually have going out with their friends. They started spending time jamming and hanging around, smoking, right, and start using drugs. And most of them have a quite steady relationship with their boyfriend, but once they get pregnant, their relationships have shattered. Right? So you look at the quote. So what they say, I knew he plays around with girls, took many types of drugs. He even impregnated one girl and irresponsibly left the relationship. I was attracted to him because he was very popular in racing and I felt proud to be with him. So even they know if the boyfriend is a bad boy, they're still proud to be with him. All right. So this boy, we see, once they get pregnant, once the girl get pregnant, they just run away. Okay, or they either get caught by the police for statutory rape, they just run away, refuse to be responsible. All right. Okay, peer influence, right? Influence is a major element contributing to teen pregnancy. Right, so now we have the emergence of WeChat, Facebook, Insta, TikTok. These young females are easily manipulated by someone they don't even know. Right, so the relational experience with peers includes having fun with random activities, activities to overcome stress, high risk activities, and they also experimenting with sex. Right, premarital sex. Okay, if you look into, this is one of the risk factors for teenage pregnancy. So a fifth Malaysian population family survey showed there is an increase, doubled of number of adolescents who engage with sexual intercourse from 2004 to 2014, right? So this, out of this, 63% of them become pregnant, right? And approximately 13% of them in Klang Valley have experienced premarital sexual intercourse, and 70% of them did not even use contraception. Again, this is due to inadequate knowledge in sexual and reproductive health. All right, lack of religious knowledge. This is one of the highest contributory factors as well. So when the teenagers have weak grasp on religion, that makes them ignore the religious rules and prohibitions. So this is in accordance to the studies that was done overseas as well. So it implies to all religion. So the studies in overseas in UK stated that adolescents with high religiosity were more careful and took precaution rather than having premarital sex. All right, so we look into the impact of teenage pregnancy. All right, generally, the maternal mortality ratio in Malaysia, right, for teenage pregnancy is around 32 per 100% live birth in 2006, and dropping to around 16.9% in 2008. Right, so what are the factors that contributing to good outcome? So when they are having high quality maternity care, when they have good parental and social supports, when they have self-awareness, they know what to do, they know how to improve themselves, and they are willing to change, and they don't involve in high risk behavior. So these type of teenagers, if they get pregnant, they have generally a good outcome compared to those who don't have all this. Right. So what are the advantage of getting pregnant early? Right. You tend to get child at earlier part of your life. Right. So when you become older, your child will be more like your friends because of the small age gap. And you can plan more children, and you can maybe complete the family early. But if you're pregnant at the age of a very young age, the risk might outweigh the benefit. So you might be paying a huge price for getting pregnant early, especially if it is unplanned and unwanted. Right. So we look into the impact, right? All right, so these are the impact on early pregnancies. So the impact on teenage pregnancy is not just a medical or health impact. It's involved a social impacts and emotional and mental effect as well. So I think you know Ibn Sina. Ibn Sina is one of the well-known Muslim physician. So he conducted a famous experiment, right? So he put two identical lambs in a separate cage, right? So he placed a wolf in one of the side cages, right? So the wolf can only be seen by one lamb, right? So the other lamb cannot see the wolf, right? Months after seeing the wolf, the lamb that can see the wolf died out of stress and fear, even though the wolf did not do anything to the lamb, right? On the other hand, the other lamb that does not see the wolf was very healthy. So this is the impact of a negative impact of the mental influence and the environments to the individuals. So this is what happened to the teenage pregnancy as well. The emotional complication perhaps happen more frequently in teenage pregnancy, right? So they are generally think that they are not acceptable by the society. They feel ashamed by what they have done. So which leads to all this, right? Unsafe abortion, emotional, social consequences, and education. Right. This is a story of Dila, right? Dila is a 15 years old. She's 4 out of 5 siblings. So Dila was stressed out because one day she overheard her parents mention that she is a adopted child, right? And on top of that, the father was a temperament man who always hate her adopted mother. So she had a sex at the age of 14 and was pregnant. Then what happened to her? She was embarrassed and afraid to be found by the family. So she aborted by traditional way by swallowing medicines acquired by herbal medicine shop. Right. So this is how they sought into the decisions of terminating the pregnancy out of stress and fear. Okay. Right. So unsafe abortion is have an impact on the maternal health. If you look into the statistic, 25 billion unsafe abortion were estimated to take place worldwide, right? Almost all in developing countries, right? And over half of this were in Asia. Right. Globally, there were around 4 to 13% maternal death attributed from unsafe abortion. And from maternal confidential inquiry to maternal death, right, 4.5% of maternal death were due to abortion in 2009, right? And around 7 million women are admitted to hospital every year in developing countries as a result of unsafe abortion. Right. These are the social consequences, right? So they are basically socially rejected, become stigmatized by the social, which leads to further damage to their physical and emotional well-being. Right. Education. Okay. So if you notice the risk factor previously that I mentioned, they themselves have poor educational level. So they drop out from school even before they conceive. What more after they conceive? Only half of them attending schools regularly at the point of conception. So this causes problems in their cycle of education, which leads to a cycle of poverty, right? All right, so this is the consequences in mid or late pregnancy. Okay, generally, right, this girl don't even know that they are pregnant, right? Some of them just come for abdominal pain, and suddenly when we examine, we notice that the fetal head is already at the pelvis, right? They just don't know because of their lack education level, lack of sexual reproductive health. And perhaps if they know also, they are trying to hide their pregnancy, right? Or perhaps they initially planned for termination of pregnancy but unsuccessful. They actually, then when they come, majority of them can't give a good history because they're trying to hide a lot of things. So what happened? They actually have no proper antenatal checkup, right? So this no proper antenatal checkup, in addition to poverty, poor nutrition, underage, low BMI, all this will lead to implications like anemia, postpartum hemorrhage, obstetric fistula, depression, right? And because when they're small, especially those who are pregnant at the age of less than 16 years old, their pelvic bone is small, right? So they are prone to have obstructed labor and end up delivering by cesarean section. Okay, and their child has higher risk of stillbirth, preterm birth, low birth weight, and their chances of this baby to die in the first week of life is higher. All right, so these are the postpartum implications. All right, in addition to this, because they are exposed to sexual intercourse very early, they have a higher risk of cervical cancer. Right. All right, so unsafe delivery. Okay, if you look into this, okay, around 50 globally, around 50,000 teenage girls die in pregnancy and childbirth, and 1 million babies born to adolescent girl also die before their first birthday. Right, so these girls, they tend to deliver at home or away from hospital, maybe because of they have no antenatal checkup, they hide the pregnancy, they are afraid of the stigma if they go to the hospital, and they have planned for baby dumping or killing the baby. So you see a lot of newspapers cutting on the girls and boys after delivery, they just toss the baby out from 13th floor, they just throw the baby out from the 13th floor, from the 8th floor, right? And when there is no plan, what happened when they have no plan? So they delivered, they said, oh, okay, what are we going to do with this baby? So they resort into baby dumping, or they murder the baby, right? So from 2010 to 2019, we have more than 1,000 cases of baby dumping, right? And 64% of these babies were found dead. So in total, right, one baby is dumped in 3 to 4 days, right? Around 2 out of 3 of these babies will end up dying. Right, so these are the statistics, right? So this is one of the newspaper cutting. So if you see from 2015 to 2018, there is around 577 cases, right? Most of them are in Johor or Selangor or KL. So you should look at the locations. They leave the baby in the housing estates, in the toilets, or in the rubbish dump. All right. And this is the trend. If you look into the trends of baby dumping here, it's actually increasing, right? If not statics, it's increasing, right? And majority of the baby were found dead, right? So this is the misery of problems that leads from the teenage pregnancy or unborn or unwanted pregnancy. All right, so in those who have future plans for the newborn, all right, 25% of them intended to take care of the baby themselves with the support from family members. Another 15% would want to raise their baby with their partners. All right, around 7% want to raise their baby on their own, but majority of them plan to place the baby for adoption. Right, postpartum depression. Right, so these young girls, they tend to have more emotional problems, more sleeping problems, and they have low self-efficacy. Right, so it is well known that unwed young pregnant women and young mothers were rejected by large society. So what happened to them? Their family put them in shelter home to avoid shame. So when they lose this attachment with their family, put them at risk of postpartum depression. Right. So how to prevent? Okay. We need an integrated program and campaign. Cooperation from stakeholders, societies, family, and friends to curb this. Okay. Right. So, parents, okay, no doubt, parents play important role in instilling good values to their children, right? So the most important thing that they have to be open to talk about sex, right? And parents also should teach the child to say no, to recognize risky behavior, and to keep a limit on the online materials that they watch, right? And parents need to spend quality time with the family. And all right, parents are not just being parents when the child is good and obedient. Okay, parents also are still parents to problematic child who is trying to find their way in the world. Okay, so when the child get pregnant, the parents have to play an important role to support and guide them throughout their pregnancy. And these girls tend to go to their partners. That is the problem. Okay, and then the partners just reject them and they don't have anywhere to go. So with the support from the parents, we might be able to reduce complications pertaining to pre-teenage pregnancy. All right. There are a law, okay, in general, a child law that protects the child. So I just take one law on statutory rape. So this is the Malaysian Penal Code, section 375 and 376. All right. What is statutory rape? Statutory rape is defined as unlawful sexual intercourse between a man and women under the age of 16, regardless of their consent. Like I mentioned in the earlier part of the slides, the age of consent of sex is 16 years old. So unless if this is when statutory rape code applies, right? So this law is intended to protect the teenagers from being taken advantages, okay? So the punishment is involved in imprisonment for a term which may extend to 20 years and may also liable to whipping sentence. All right, so I think you know about this case if you are a TikTok, into TikTok and all this. Right, so this girl, right, posted on SOCMED, a teacher said, okay, so if you all nak, nanti kalau korang nak rogol, janganlah rogol bawah 18. Rogol lah yang atas 16. So this teacher is made fun of rape, right? So teacher should know that rape is considered a crime, regardless whether it is done less than 16 or less than 18 or more than 18. It's a crime. It's a crime. Okay? Then what happened? Right, so these are one of the response, okay, from our one of my seniors, Dr. Pravin. So this is the problem that we have, okay. Just to point out, right, rape should not be normalized, okay. It's not something to make fun of. It is something serious, right? So if you look into the statistic, right, 50% of this rape, statutory rape, is a case of consented sex, right? So majority of them, 80% of them, was someone that is close to the victim, right? So that's why it ends up only a small percentage of case will end up in court, and most of the case will drop off either because of pressure from the family or from the victim themselves who wants to protect their privacy. So are women safe in Malaysia? All right. Okay, you look into this statistic. All right. So if you look, only 1 in 10 rape cases are reported. Okay, and out of that, only 16 are prosecuted, only 2.7 are found guilty, and 70% of rape happen in safe place such as home and school, right? And 80% of rape victims actually knew the attacker, and most of the rape victims are under 16 years old. So girls are not safe, generally safe in Malaysia if you look into the statistics. All right, what about child marriage? Okay, there are actually effort, right, to look into the law pertaining to underage marriage. So since 2018, there are news on reviewing back a Sharia approval of underage marriage. So this is our old Minister of Religious Minister. So actually the current Religious Minister also continue the same effort. So in terms of Sharia law, so initially there is a role, an effort by religious authority to review it back, the procedure, to have a tighter rules of child marriage. But there are also states like Selangor already amend the law to minimum age of marriage of 18 years old. Okay. Right. So what about sexual education? All right. So sexual education was a part of our syllabus since 1989. So we called it Pendidikan Sexuality and Reproductive, or PEERS. since 1989. So I think maybe a lot of you, all of you have gone through the sexual education, right? So it consists of 75% of pendidikan kesihatan subject, right? But to those of you who know or who have learned this in school, do you remember and do you able to implement it, right? So if you look into the curriculum, there are arguments by clinicians or by academicians that this curriculum is too academic oriented and exam oriented, okay? And there are something missing in the curriculum, right? Something that is not there that makes the child or the teenagers go to other places to find about it and to actually try it. So the teachers also are not trained to teach on this subject. So that's why they are shy to teach. Some of them think that the subject is funny, and some of them too embarrassed to teach, right? So we have to improve. Although this has been there, but improvement need to be done in the sexual education to our schools, right? All right, so I think this is one of the important keys of prevention. Okay, we should include boys and men in teenage pregnancy prevention. Okay, so like I mentioned, okay, boys are more exposed to early sexual relationship than girls, and they strongly influence the teen girl's decision about sex, right? And it takes two to create pregnancy. Okay, however, when the girl get pregnant, they are the one who get judged, not the father, right? So if you look into the strategies and the plan to reduce teenage pregnancies, they are all targeted to girls, okay, less likely boys. So what happened to the boys? They seems to disappear after they make the girl pregnant. All right, and study also shows that 70% of boys thought that contraceptions are the responsibility of girls, not them, right? So that is why it's important to engage boys and men in teenage pregnancy prevention. Right, so you have to empower the boys, teach them to recognize the right and respect of the woman and girl. Right, so they have to move away from the concept of traditional masculinity, who thinks that they are superior than female and the female have to follow their leads no matter what. So this should be taken away, right? And they have to know how to manage the peer pressure of having sexual relation, right? And they have to be empowered to take responsibility of their action and empowered with religious education and practice. And of course, there is the parent and peer roles in this, okay? Right, so this is one of the poster of teenage pregnancy campaign in Africa. So it takes two to make a pregnancy. I decide to respect girls because true love waits. Okay, very nice poster. Right, so we go to empowering girls. Okay, so girls have to be taught to respect and protect themselves. Right, so they have we need a special program for them to understand the importance of developing their own agency and decision-making skills and communication and negotiation skill pertaining to handling relationship. Okay, they have to be of course there are parent and peer role as well, sexual education, religious education and practice as well, and they must be equipped with adequate knowledge to protect themselves and what to do things should things happen. All right, so what to do when they get raped? Some of them feel humiliated, they keep quiet, they only report after a few days, some of them don't even report. So they should know that the chance to get the culprit convicted are greater if they report it immediately, and because all the evidence are still in their body. And they also should know the signs of pregnancy, right? When do they have to suspect themselves as pregnant? So when to do UPT and what to do next after once she get pregnant? So where to seek help? They have to know about this, right? Right. Social support and government policy. Okay, for me, this is also part of the important campaign to curb teenage pregnancy and to reduce the complications of teenage pregnancy. So first and foremost, we have to address poverty because this is one of the main risk factor for teenage pregnancy. Okay, then you have to enforce law on porn restriction like access, recording, record keeping. And there should be an easy pathway of rape reporting, right? The children and the girls shouldn't be embarrassed to report if they get raped. And then there should be improvement in teenage pregnancy management in healthcare setting. Access to education. So this is a Sekolah Harapan. Sekolah Harapan is a school in Malacca dedicated to pregnant teenage mothers. This social stigma thing have to end, right? To reduce the complication of teenage pregnancy, we have to actually support our teenagers together. All right, baby hatch, safe home. This is a controversial issue, right? Well, but for me, if you look into the statistic of baby dumping, they dump the baby at that housing estate, in the toilets, right, in the dustbin. So for me, it's better for them to just put the baby in the baby hatch rather than putting them somewhere that is not safe. Right. Right. So if you ask me, there is still a long way to go for us to prevent premarital sex, child marriage, and teenage pregnancy, and for us to prevent complications of teenage pregnancy. So the girl should feel safe everywhere they go, either in school or at home, on the streets or public transport. Okay, so teenage pregnancy is a global issue. Okay, it is associated with morbidity and mortality. It can be prevented by structured strategy and cooperation from all. But once the girl get pregnant, okay, we should actually we should end the social stigma and provide good support for them to reduce the morbidity and mortality related to teenage pregnancy. Right, so this is the end of my lecture. Then I would like to wish all the Muslim viewer Eid Mubarak. So we still have 4 days to go before we celebrate Raya. So may Allah Subhanahu Wa Taala accept all our good deeds, forgive our sins, and grant us Jannah. And with that, I would like to thank you for listening, and Assalamualaikum warahmatullahi wabarakatuh.
A splendid and informative talk about young females being a mother, I would say. The slides were quite interactive, Doctor, and thank you so much, Doctor. Today, I really learned a lot regarding pregnancy, childbirth, child dumping, teenage pregnancy, and how they can take care of their baby. And I really feel sad for those pregnant girls and their babies. And I really hope females in our country are safe. And again, Doctor, I would like to wish Happy Mother's Day to you. And if you don't mind, you can help us convey our birthday wish to your daughter.
Thank you.
All right. I think after each lesson, there will be some burning questions regarding the lesson that the teacher has taught. Hence, participants who have crucial doubts about this topic can send your questions into the chat box of YouTube Live, and I'm sure Dr. Amelia will answer them one by one. So let's pick questions.
Okay.
Okay, but Doctor, I have a question on my own. Can I ask it?
Okay.
Okay, my question is actually, what should a pregnant teenage girl do if none of her family members are helping and she got pregnant unexpectedly?
All right. Yeah, this is the dilemma that the majority of the teenage girls have. Okay. So if you look into the points that I presented just now, majority of them have lack of education. They have poor socioeconomic levels, right? And they don't have good family support. So, but they should know that once they get pregnant, they should come to us, right, to the health clinic or to the hospitals to check about the pregnancy. Okay, so she can either come to the government clinic or to a private clinic, anywhere that she feels safe, right, to check on the pregnancy and to follow up on the pregnancy. And she can actually uh, talk to us about what is her plan, right? So she needs adult to advise her, right? So of course, we as a doctors, right? You are also going to be doctors and being parents. So if you see a pregnant mother, okay, especially a teenage mothers, right? Social history is very crucial, right? So we don't judge, right? Our professions, right, hinders us from being judgmental towards our patient, right? We treat all the patients the same, right? So you have to scrutinize on the social history, right? The support that she has, the level of education, the job that she has. Can she take care of the child, right? And you have to grab them and make them trust you, and you need to help them. So usually what I did, I will look into the problem that they have. Okay, if they have problems in terms of support, I will actually contact the NGOs that actually taking care of these teenage mothers, and usually we will co-manage these mothers together. So as long as she is safe during her pregnancy period, she gets a good healthcare service, we can prevent the complications, right? What happened after that to the mothers, to the babies, they need to be a proper plan. Okay, so in hospitals, what we did that for these teenage mothers or unwed mothers, we have a social support service, and also some religion service as well. Okay, so the social support service will ask the mother, what is your plan for the baby? So if the mother plan for adoption, the baby, then the social welfare will take care of it, will help her. All right. Okay, Shri, is that answering your question?
Yes, doctor. Now I get to know what can we do if a teenage get pregnant unexpectedly and no one is supporting. Okay.
All
Now
right.
next, we have another question from Fire Glory. Good morning, doctor. Thank you for the talk. May I ask, despite all the serious consequences that doctor mentioned just now, why there are still communities that support the idea of early marriage?
All right. If you look into the history of early marriage, all right, so this has been accepted worldwide since previous years, okay, whatever era that they have the previous years. Okay, some of them actually have a culture that this teenagers have to get married early, all right, especially in Orang Asli tribes or in certain tribes in Sabah and Sarawak, okay, so that they can actually conceive early. This is actually out of poverty as well. Okay, some of them, because the parents are actually living in poverty, they tend to marry their children or their girls early, so that the husband can take care of the girls. All right. So I agree that there are actually still a low insight on this. Okay, but slowly the stakeholder and the governments are changing, right? So they have looked into this teenage pregnancy matters, and they the early marriage matters, and some of them have changed the law to actually minimum of 18 years old before they can get married. Okay, thank you so much, Fire Glory. You have such a nice name.
Okay, I hope that answers your question, Fire Glory. Thanks, doctor. And next question by Arif Najmi. Is it plausible to make a tight law, especially on students and teachers, since this occurrence mostly happened on students?
Tight law on what, Arif?
I think he might talk about the students and teachers about the maybe I think he meant the joke, doctor, the rape joke that
Oh,
happening.
okay. There are things that are called sexual harassment. Okay, so sexual harassment are not just by physical. It can be through communication as well. There are laws on that actually. So if you look into Adik Ain just now, she is being sexually harassed by the boys in her class as well. So she made a police report. So actually the laws are there. For me the laws are there, but it's just whether you want to report it or not. So the problem with our community is we take this lightly. Alright, tak apalah, sikit-sikit je dia melawak je tu. But if you start to normalize this thing, so the small thing will become bigger, right? So it will become bigger, and soon this when big impact happen, we don't have ways to actually prevent it to happen any in other ways, right? So for me, if you think this matter, sexual harassment, talking about sexual harassment, even a sexual harassment should be taken, it should not be taken lightly. All right, so there are laws on this. So don't worry, Arif, the laws are there to protect the teenagers. So it's up to the teenagers whether they want to report it or not. Okay. All right. So do we have any more questions?
Yes, doctor. This is from Shagan Gani. Uh,
Mm-hmm.
Hello, doctor. Regardless of nation's law of prohibiting abortion, do you think the
Mm-hmm.
malnutrition and mental health issues in pregnant teenage girls considered as a valid reason to perform an abortion?
All right, thank you, Shagan. Okay, to tell you the truth, Malaysian has a law regarding safe abortion. It is actually legal if the pregnancy is a threat to the woman's life, and when the pregnancy poses a threat to the woman's physical and mental health. All right, so but that is the law, but we have a religion law as well. So it actually depends on all the, if you look about it, to all the religions actually prohibits abortion. Okay, so I covered abortion in one of the CPCs of year 5, and I think I will cover it as well in this year regarding abortion. So but for me, you need a really valid reason to abort, because the fetus that the teenagers are carrying is also alive. There's a life there inside the teenagers. So like how we thinking about killing people, all right, there is a law on actually preventing on abortion as well. So you must have a valid reason, because it's, if you don't do it for a valid reason, then it then might be like sort of like killing, right? So in certain countries where abortion is legalized, okay, when a girl um, planning or expressing their concern on the pregnancy, and they said that they want to terminate, all right, so they will go into a series of assessment by the medical practitioners, sometimes by the psychologists, by the obstetricians, right? So if the pregnancy really does have an impact on the girl's life, then the doctors will decide that abortion is valid to perform on her. So we have a few cases on this. All right, Shagan, does that answer your question? Right, but I think it shouldn't be decided by someone, or by young doctors, because this is a huge decision. All right, so it has to be discussed at all level.
All right, thanks, doctor. We have another question from Tommy Jones. Baby dumping has been a major issue until now, especially among teenagers. Why have sex education not changed throughout the years of implementing it, as there is still a rise in the cases?
All right. Thank you, Tommy. Tommy. Actually, they have changed the sexual education. So from in 2004, they changed the syllabus, and recently also they changed it. But the problem is, I think there are something missing in the sex education. Hmm? They talk about the prevention. They even taught a Form 1 student on contraceptions, right? But um, there are no topics on sex per se. I don't think there is a topic on sex per se. I'm not sure because I am not part of the students who actually have the opportunity to learn this sex education during my school time. That's why they learn this sex thing from pornographic materials from their friends. Yeah, I agree with you, Tommy. There should be changes, but the problem is we are so shy to talk about this. Right. The community, the teachers, they seem not ready to talk about this openly, right? But the problem is the child get this from the internet. So if they get it from internet, so the internet might actually teaching them the wrong knowledge instead of the one that we want them to know, right? So there are effort in changing this again. Well, but I personally think the contraceptions and the reproductive education that was teach in school is actually your level. We teach them to medical students, but now you saw even my son who is from 4 also know about how to what about IUCD, about implanon, and they know up to the level of what happen if the tube is blocked. So how do you manage? So this is something that is maybe they don't need to know, right? Not their level. So I yeah we I think there are efforts on changing this, but it takes time. So like I mentioned to you, we still have a long way to go. We are taking a baby steps on preventing teenage pregnancy. Thank you, Tommy. I hope I answer your question.
All right, thanks, Doctor. We have another question from Nurul Ashikin. Salam and happy Mother's Day, Doctor. I would like to ask if these young girls give birth and send their babies to other people, is it possible for them to see their baby again in the future?
Right. So this is a question from a future mother who actually have a strong bond. They can feel the bond of the mothers and child even before they get pregnant. Yes, Nurul, there are no laws that actually prohibits the real mother from seeing their child. Okay, so even if they send the babies for adoption, so they actually can trace where the baby go from the social support system, and they can actually see their baby again in their future, right? So that's why the mothers who actually take the child for adoption have to be prepared. All right, they shouldn't hide the fact that the child that they adopted are not their child. Okay, so they have to be prepared that maybe one day the real mother might come looking for the child. Okay, thank you, Nurul Ashikin. I think you're going to be a good mother after this.
Nice explanation, Doctor. Again, from Fire Glory, another question. Doctor, does the postnatal care for teenage mothers is the same? Can you share your experience dealing with teenage mothers?
All right, the care of the mothers, the teenage mothers, are a bit different. Okay, because we need to know what are their plan for their babies. So we don't want them to end up dumping the babies or ending up with postpartum depression. So that's why if you look into teenage mothers, especially unmarried mothers, they will stay longer in the hospital. So we will have to call their parents, and whoever that will support them, and they will actually have a session with the social support or social workers on their plan for the babies. Okay, so they will not be discharged until we get a clear plan, right? Of course, after discharge, maybe the plan change, that is beyond our control. But when the patient is with us, as far as we can, we will try to our best to make sure that when we discharge the mother, they have already a plan that is best for her and for the baby. Can you share your experience dealing with teenage mothers? Oh, I have a lot of experience dealing with teenage mothers. But I will tell you one story of unplanned, unwanted pregnancy. Okay, this is a story of a young Indonesian maid. Okay, a young Indonesian maid who comes here. I think she's around maybe 17 or 18 years old. Okay, so one day, I was called to the emergency department because this mother actually this girl actually come with bleeding. All right, so there is a lot of bleeding, so she basically pale and bleeding. So as usual, we resuscitate, right? So and then when I examine her, I noticed that she has a signs of pregnancy. Okay, so that's why for those who actually an ONG, right, you have to know the signs of pregnancy. Even if when the fetus is not there, the signs will stay there for a while. Okay, so the uterus is sort of like not contracted, and there are signs, cutaneous signs of pregnancy. And when we do a vaginal examination, there is a cord there, right? There is a cord there outside the vagina. So then I asked her, okay, my dear, you just gave a child. Where is the child? So she refused. She just refused to tell, and she actually denied that she's just delivered. You imagine or not? So this is the how it feels like dealing with them. Okay, so we have to call the police and ask the police to search for the baby, right? So to make things short, in the end, they found the baby. The baby was stuck in the toilet bowl, died. Okay, so that's why sometimes you have the chance to save the baby, right? So if you don't know the signs of pregnancy, if you don't even think that she's pregnant, and you believe the patient say that, well, I'm not pregnant, so you will lose the chance of saving the baby. Okay, so that is one of the story. Okay, I have a lot of other stories, so that is the only story that I can tell you for the sake of time. Okay, thank you, Fire Glory.
It was a nice experience, but a really sad story, doctor. And from
Yeah.
below, we may she states a situation that she observed. A situation that I observed in Malaysia is that one extreme, a lot of them marry late and have low pregnancy rate, while at other extreme, early and unprepared pregnancy and discourage contraception. And the question following her statement is, Doctor, how can we do to make them more toward the center of the spectrum? Or is it the current bipolar situation is good enough to be maintained?
No, Yimi, definitely no. So I think we have to. That's why I'm telling you, there is a lot of things that need to be done. Okay, recently maybe the health of the mothers and the child was not taken into priority because of the COVID thing. All right, but the Ministry of Health, Ministry of Women and Child Health, right? The Ministry of Women and Child actually put a lot of effort in actually making them towards the center of the spectrum. Okay, we can't actually prevent it 100%, but at least we can reduce it slowly, right? So there are a lot of other factors that makes them decide what they do, right? And some of them we have seen them too late, right? So we as doctors, right, so we have all levels, we are actually involved in all level of preventions. Okay, we started off with preventing them from getting pregnant, right? But once they get pregnant, what we can do is we have to prevent them from all the complications, right, by giving them the best care that we can, right?
All right.
Okay.
Thank you, doctor. I hope that answers your question, Lo Hee Mei. And I think that is all for the questions for this talk, just like the time has permitted. Very good. Thanks, hearty thanks, Dr. Amelia, for clearing the doubts. The questions were indeed very curious. Well, every great achiever deserves a prize in the end. So, Dr. Amelia, we would like to express our gratitude with an e-certificate to you for allowing yourselves to join our event today. We do understand that your
Thank you,
schedule
Shri.
is. Yes, welcome, doctor. We do understand that
So
your
I hope
schedule.
I have a visual hand to receive the certificate.
I said an e-certificate, doctor. Also, yeah, this is the e-certificate, doctor. We understand your schedule is packed, and yet you came. So thank you so much, doctor.
Thank you, Shri.
All right. Now, precious moments should be captured for golden memories. So, Dr. Amelia, we would like to take this opportunity to capture some photographs with you and the board of directors for this event. For that, I require the members in the StreamYard to open the camera. All right. 3, 2, 1, cheese. All right. Thank you. Okay. Now comes the high time for the participants who are seeking to collect e-merits. Attention to all the participants. The QR code will be displayed for 5 minutes only. If you happen to encounter problems in scanning the QR code, you can press the link for the Google form provided in the chat box and fill in your attendance. Take note that the form will be accepting responses for 10 minutes only. Well, while the students register their attendance, I think it's about 11:22 a.m. and I think this event shall come to an end. It was a fruitful session with Dr. Amelia regarding young mothers, and I would like to repeat my thanks again to Dr. Amelia and all the participants today. And I would also like to apologize for any inconvenience caused. And I wish again Happy Mother's Day to you, Doctor, and all the mothers out there. And a kindly reminder for those who have registered for the Safe Motherhood Talk are requested to follow up with the link that will be given in the YouTube live chat box. Thank you again, Dr. Amelia. Have a nice day and goodbye.
Thank you, Shri. You too have a nice day.
Thanks, Doctor.
Okay.